Thank you, Dr. Dale. Appreciate it. The first question was from a school teacher that wanted to know how she could help her high school students. And then I had another question as well. So I put them both together. How can local school teachers help both elementary and secondary students?
Well, first of all, thank you for having me. Let me start by saying thank you all. Thank you all for being here. This documentary has been in my mind for like 8 years, roughly. And when something's been in your mind for so long, and then we actually worked on it for 2 years, give or take, and to see it actually, come to fruition, we made the film. But after you make the film, you say, is anybody going to actually watch the film, right? You start watching the film, so that's exciting. And after that, you say, well, they're watching it, are they going to like it? And they start getting the feedback. And I mean, we have, I don't know, probably 750 reviews now. Almost all of them are 5 stars. So, just to see that, see people watching it, see. And we didn't just make it for entertainment. We made it to have an impact. So to have these discussions and see the impact, I just thank you all for that. So it's fascinating because most of the calls I've had so far, I don't know, I've done maybe 30 of these past few weeks. And most of them have been with medical schools and with hospitals, large healthcare systems. So they ask that question, but they ask the question from the other way around, from their position. So I would give the same answer, but just turn it backwards. So normally I say, well, as a medical school, you all should be reaching out to the elementary, junior, and high schools and trying to do programming with them. And programming is, the feedback I get is, well, it's too hard to get into the schools. And I tell them, I say, well, is it really? Because I don't have that hard of a time doing it. It seems to me that most counselors are looking for things like this. I plan on doing something this summer, the YMCA here. I'd like to do something with the YMCA. I emailed them today and they immediately emailed back like, we would love it. So, we never get resistance. So I would kind of flip it on you all the other way around and say, you all can have programs and reach out to the medical schools and say, hey, can we do this program with the school? And here's how simple it can be. All it has to be is a quarterly Zoom meeting where you get a med student to hop on a call and answer questions from the kids. And you have each kid submit a question. It's, that would literally take, for you all, it'll take, it could be a 30-minute session. And it takes, very little time, like no money, except for maybe the cost of the Zoom. But, your schools probably have that already, or the medical schools have it. And for the medical school side of it, they're looking for, it's almost like a dating thing, right? They're looking for ways to help. You guys looking for ways to connect. So, just one needs to reach out to the other. And, both parties are going to say yes. I would say that's the easiest thing, especially the young age, the, 8-year-old, 9-year-old age, really is just about them seeing somebody wearing a white coat who's willing to be consistent, right? If somebody can show up once a quarter, I think that's going to be huge for the kids.
Fantastic. And especially somebody that looks like them, and
Exactly.
That's even better. What suggestions or advice can you give a single mom on how to keep our sons not only interested in pursuing their dream, but to stay focused on the importance of education in general, even in grade school?
I'm fascinated. That's actually why I wrote the How to Raise a Doctor book. The way that book came about is we started putting these short Black men in white coats videos out online. And I think it was Facebook or something. There was a mother reached out to me and said, hey, Dr. Dale, I'm a young, single Black mother, how can I help my child become a doctor? So that's where that question is actually where this book came from. And a lot of ways, but the first thing I would say really is figure out what they're interested in. And you all, a lot of you all might have gone through the parenting thing. My oldest child is only 9 years old. So in the book I say, well, how can I tell you how to raise a doctor? My kids, at the time he was like 5. And the way I actually wrote the book was I interviewed a bunch of parents and physicians. That's how I ended up writing the book, just to get their advice. I put that in the book. And one of the big things is really figuring out what they're interested in, like what they're really interested in. Because sometimes parents want their kids to be interested in medicine, but is the kid really interested in medicine or not? So figure out what they're really interested in, and then find unique ways to get them exposed. And nowadays, I think it's easier now than ever with YouTube and social media. There's so many online curriculums, so many things you can find online to engage your kids in and get them active and doing things in it. Here in Dallas, and we're gonna, we do it across the country a little bit, but we're really gonna expand. We have these Black Men in White Coats youth summits. And what we do is we have a big summit. So in Dallas, we'll have a summit, 1,000 people show up as kids, parents, teachers, everywhere, just packed out. And we have all these fun activities for the kids to do. And that's great. But what's even better is we try to help the kids make connections with some of the doctors. So then thereafter, you have kids going out and shadowing. Like my brother-in-law is a dentist. So from the summit, he'll have like 7 kids who come and start shadowing him throughout the year. And that helps keep these kids engaged. That helps keep these kids with a consistent role model in their life across the board. So that, I think that's the biggest thing. Find what you're interested in and find ways to expose them to that, right? Because exposure is huge. I think we really undervalue the idea of exposure. Can you, it might sound strange, but can you find a way to get a doctor to have dinner with her kid, once a quarter, right? And doesn't even have to be like one-on-one. It can be kind of what I was saying before. So I'll tell you, Black Men in White Coats, we do quarterly mentoring lunches. So once a quarter, we get on a Zoom call like this, a few hundred people, a bunch of kids, doctors, and we sit down there and we talk to the kids, we break up into small groups. Like that's engaging for the kids. That re-energizes them, gets them encouraged again to come back every quarter and see somebody who looks like them, talking with them.
Fantastic. At this moment, I'm going to invite Dr. Stacy Yeager to share, pose some of her questions to you. Dr. Yeager.
Thank you. And Dr. Dale, it's so good to meet you. The documentary was excellent. I serve on the Kansas City, Kansas Board of Education, and I want to acknowledge my fellow colleagues, Maxine Drew and Randy Lopez are also on, and I see Rosalind Brown, who serves on the Kansas City, Kansas Community College Board. So there are a number of leaders here listening to you and looking for your advice. So when we think about the medical workforce and the lack of reflection in our community, what would it truly look like if our community did reflect more of a diverse medical staff? How would that look, and how would that change our communities?
So good question, Dr. Yeager, and thank you for being here. Thank everybody else. Thank everybody for being here, but I'll make a specific thanks to the board for being here as well, because that's huge, right? It's huge to have the decision makers here hearing this thing. So kudos to you all for this. So a couple thoughts on that. The first thing is the question I would ask, even kind of taking a step back from what you said, is how many, let's just stay focused on Black men. How many Black men physicians do we need right now? And this is the answer I say, we don't really need any more Black men physicians, right? So it sounds funny, but hang in here with me. So we don't really need any more, right? What we need is a physician population that cares about these patient populations that we think are being overlooked, that cares about the healthcare disparities, cares about that. You could be a white man, you could be a white woman, you could be purple, but I don't care what you look like. But the reality of the situation is more than likely people are going to care from those areas, right? More than likely, if you're a Black man, you'll be more inclined to feel for another Black man. So that's why we need it, right? So that's why we need more Black men in the field of medicine. That's why it's important. I say that to make it clear that never am I saying that a Black man is a better doctor for Black patients than a white man, or a Black woman, white woman. I'm never saying that, okay? But we do have the data. We do know that if you're a Black male patient, you're more likely to listen to your doctor's preventative healthcare recommendations if your doctor's Black. We do know that if you're Black, you're more likely to go to a community that's like where you came from. So that's why we need these things, okay? I just want to say that up front. So let's say we do get to 13.9, whatever we're at, 14% representation in the field of medicine to reflect the Black population in America. Let's say we do get there. The question still remains: is that even enough to overcome the healthcare disparities? So even getting to that number might not even be enough, because say, oh, now we have 13%, we're good to go. Okay, we have 13, 14%, but the healthcare disparities are still so enormous that even that percentage might not be enough to make the impact that change. And even when you do get to that 13, 14%, there's something called the minority tax. They call it the Black tax or minority tax. That 13, 14%, they don't always get to focus on just your clinical duties, right? Like look what I'm doing. I got a full-time job as a clinician. I made Black Men in White Coats in my spare time. This is my time with my family, my kids and stuff. I did all this in my spare time. On top of that, I've got to do all the extra diversity stuff that they asked me to do at my institution, right? So even though I'm part of this 13, 14%, I've got so much going on. Am I fully contributing to that patient population in ways that I can? So I wanted to throw that in there to say that first. But then to more directly answer your question, what would things look like? So what do we want out of this? The biggest thing I would say is agenda setting. The biggest thing is having people who can help set the agenda. So let's say even if we don't have, it's funny, my alarm for the 7:30 is going off right now for this meeting. Let me close that alarm. So even if we don't have the full 13-14%, as we're working our way up to get appropriate representation, it's important that we have people at the table. It's important that we have people who can say, hey, let's make sure this community in South Dallas is not overlooked. A prime example, I'm at UT Southwestern Medical Center in Dallas, Texas. So Mark Neve, who was in the documentary, he's the guy who actually figured out he's the one who mentioned that he had to talk to Howard, and that's when he realized the number of black men were going down. So he ended up coming to UC South. Well, he wasn't here. He came here a few years ago. And when he got here, South Dallas, parts of South Dallas are rough areas. There was a big empty mall. The big mall used to be a very, very thriving mall back in the day. It became this kind of abandoned building. Not much was happening there. So since he got here, he's been pushing very hard for UT Southwestern to go set up clinics and stuff down there for the patient, for the community. So that just got approved recently. So now we have clinics that are down there taking care of this population. And why did that happen? Because you had somebody at the table who could help set the agenda. So I think that's the biggest thing that I think about when I think about representation. One-on-one, me being able to talk to a patient who looks like me, or maybe they don't even look like me, but who I can relate to on a certain level, that's important. But having somebody at that table to set the agenda and say, we need to look at these populations, we need to make sure they're taken care of, that's huge. And that's what it looks like when you start getting more people from diverse backgrounds at the table.
Good. I love that. I think it's so important that you mentioned that it takes more than one person. It takes a community. And so in thinking about that, many times we hear like people saying they're not role models, they're not mentors. So what does it look like? You said you have a mentoring program and there's many leaders on the call. What does a mentor truly look like? And what is their role to helping students succeed?
Oh man, so I'll tell you, most people get this completely wrong. Mentorship. So think about where the word mentor comes from. So we got librarians, we got smart people on the call, readers and stuff. Remember the Odyssey, the story of the Odyssey. Epic tale. This guy Odysseus going on this long epic journey, right? He's gonna go out there, slay the Cyclops, kill the dragons, do all that stuff. He's gonna save the day. But Odysseus has one problem. What's his problem? He's got a kid, Telemachus. So he's like, I can't take my kid on this journey with me and do all this stuff. So what am I going to do? I've got an idea. Walks over to his buddy's house, knocks on the door, knock, knock, knock. Hey, mentor. That's his buddy's name. His buddy's name is Mentor. Hey, mentor. I'm going on this long journey. I'm going to slay the Cyclops. I'm going to do this, beat that person up, do that. I want to save the day, but I can't take my boy with me. So while I'm gone, can you look out for him? Can you help him? Can you be there for him? Can you kind of prepare him the way that I would prepare him if I was here? That's where the word mentor comes from, right? So when you think about what that really entails, right? That's a deep, intimate, serious relationship. That's taking somebody, that's being responsible for somebody else's success, right? I'm imagining if my next door neighbor came and told me that, I'd be like, oh my goodness, this is a lot. I don't know if I can handle this. You're leaving, you want me to do, that's a big deal. So that's where the word mentor comes from. So if we use the word mentor, as we got it from, that's where it comes from. So if we use it from where it came from, that's a huge thing. So, what does a mentor look like? A mentor is intimate relationship. It's somebody who's close, who knows you, like who can be real with you, who can call you out on things. It's longevity, right? It's something that happens long over time. It's consistency, somebody who's going to be there for you. Advising is important, but an advisor is a different role from a mentor. A coach is a different role from a mentor. A counselor is a different role from, they can overlap, and a mentor does advising, a mentor does all those things. But a lot of times pre-meds will mistake and say, well, I have an advisor. I say, an advisor is an advisor, not a mentor. You go to an advisor for advice, right? A mentor gives you advice, they give you lots of, but a mentor walks the journey with you over time. And it's a very big investment. So when I hear people tell me, people say, yeah, Ben, Dale, I'm mentoring 30 kids. I'm like, no, you're not. You're not mentoring 30 kids. If you are, you're not doing a good job at it. I'll call myself out right now. I got a message from one of my mentees last week, which I just checked yesterday. And she wrote to me, she said, the message I read was like, hey, Dr. Dale, I know you've been really busy and everything like that. I need to know if you actually have the time to mentor me. And she asked me to be her mentor like months back. And I told her, I said, you know, honestly, I'm really busy. It's going to be hard, but I'll try to do my best. I'll try to do my best for you. What I should have done up front was tell her I can't do it. That would have been the right thing to do. But you know, we want to help. We take too much on. So, you know, yesterday I emailed her back and I said, you know, I'm sorry, you're right. You know, I bit more than I could chew. You know, what I would advise is that you find somebody who can dedicate the time that you need, you know, for that. Because mentors also need training. Mentors need to know, you know, how to handle things. And I don't read all the chats, but I saw the word sponsor pop up in the chat just now. So it's another thing. Sponsorship is completely different from mentorship, right? A mentor takes you, shows you the way to the door. A sponsor opens the door and lets you get through it, right? So a sponsor provides access. A sponsor gives you resources. A sponsor sacrifices something, whether they put their name on the line, money, whatever, to do something to get you to that next level. So those are things that we really need a lot more in the underrepresented minority community. You know, the difference between those who are successful and those who aren't successful is who has access to the resources to get successful, right? You know, people always ask me, say, what advice would you give to your old self or to a high school kid? I'm a person of strong faith. So my first advice always goes to faith. So be solid in your faith, right? That's my first piece. The second thing is get a mentor. Second thing is get a mentor. People are like, yeah, but wouldn't you tell them to read this? But wouldn't you tell them to do this? Get straight. I'm like, no, get a mentor, because you're always going to have more and more questions. If you have the right mentor in your life, they can help you figure everything else out. Get a good mentor.
So in your journey, I love that you talk about mentor, because I truly believe in mentoring and coaching. So what was the most difficult part in your journey? If you could pinpoint something that, you know, you went through struggles and trials to get where you are, if there was something that, you know, and many times we see the end result, right? We don't see the journey, the ebbs and flows, but we were able to see that. If there was one point in your journey that you could change or modify, would it be anything that you could see, or anything that you would give those who may be listening and they want to contribute, they want to help, they want to do more? What is one turning point that really pushed you to there was no stopping you?
You know, I'm kind of built like that, so mine was probably different. I will say my journey was a little bit easier. It was a lot easier, and it was easier because I had a mentor. It was easier because my brother, who's 2 years older than me, went into medicine, right? So, and my parents, you know, I'm a 2-parent household. My dad has a PhD, so my parents are very the great thing about and I talk about it in the book, How to Raise a Doctor, is my dad, he wanted to go to med school and such, but, you know, we immigrated to America, and, you know, how it is, it's rough, and you have to figure things out, right? So he didn't have the opportunity to go back. He sacrificed for, you know, family stuff. But what he did a great job at, him and my brother, was they learned what they needed to learn to help us. So they took the time out as parents. They equipped themselves so they could equip us. My brother went to college. He had to figure a lot of stuff out because he didn't know, right? So he's figuring out how to do this, figuring stuff out. So it was a lot harder for him than it was for me. But for me, it was like, hey, Daniel, what do I need to do? Oh, here, take my book, right? So I had the easy one, as my brother would be either. Dr. Ellis Ingram, I call him my first great mentor. He's in Columbia, Missouri. If you say a turning point, he was kind of a turning point for me, because when I got to the University of Missouri, you guys know, you're in Kansas City. You know, not too many people in Columbia at the school that look like me, right? So when I got there weren't too many people who looked like me, trying to do what I was trying to do, etc. But Dr. Ellis Ingram was there, a Black man who was a pathologist, and he looked out for all of us, people who, you know, all of us, and he still does it to this day. And having him in my life, having him being able to see that, like, wow, this guy is a big time guy. He actually cares about us. That was huge. That was something that kind of, about to call a kind of a defining moment for me. The hardest part of my journey, is going to sound funny, but the hardest part of my journey was my wife and I. She's my wife now, but we started dating freshman year at Mizzou. We went to 2 different med schools. So the hardest part for me was trying to adjust and dealing with that. It was rough. It was a rough couple of years. I mean, you guys know how it is, trying to figure out how to be young and in love and med school and stressors and all sorts, you know, things like that. That was the hardest part for me, trying to figure that out.
Well, thank you. And I appreciate when you share the struggles, because again, people behind the scenes do not necessarily see the struggle. Those who haven't seen the documentary may say, oh my goodness, his ride was just so easy. And my daughter wants to be doctor. I have my PhD. Her dad has his PhD, so it's like a no-brainer that certainly that she was going to become a doctor. But my next question is, you wrote a book about children. You have a lot of educators on here. What is a couple of things that educators who are in power, what can we do to help get students on that pathway? You know, we have the standards for our school, we have the standards already, but nothing says, oh, here's the path to be a doctor. We have the mentoring program that we partner with KU Medical Center, and students can go there for the summer. But what would you encourage those listening who may be in charge of curriculum or in charge of a summer program? What is some key things that we can do here in Kansas City, Kansas, that wouldn't stretch you too much? Because you said you do a bigger platform of it, but what could we do locally to have our own little doctor path or what have you?
Yeah, thank you. And I will email Ms. Lovers about our summit, the Black Men White Coat Summit, so and tell you guys what it takes to do one of those summits. But I want to back a couple thoughts on that. First thought on it is, let me break down the name Black Men in White Coats. So first of all, it's for everybody. Black, it's called Black, whatever. Anybody can come, but we focus on, you guys know why we do that. Men, same thing. You guys know why we call it Black men. You saw the documentary, the data for it. But if you come to our summits, it's men and boys and girls everywhere. It's probably almost 50-50 if you ever come to our events. Now, white coats is what I want to touch on. So I always tell people, what is your white coat? Your white coat doesn't have to be a medical doctor. My white coat is medical doctor, but your white coat might be law. Your white coat might be engineer. Your white coat might be a businesswoman or businessman. So what is your white coat? And that's important for us because at our summits, even though I want you to be a doctor, right? I would. That's why we do it. Right? That if you become a doctor, that's a bonus for me. That's just a bonus for me, right? The purpose of our summits are to help put kids on the path towards professional development, teach them to give them the tools they need to learn how to be successful in a professional world, right? Things that take higher level education, things that you do beyond college, things like, right? We put them on that path, that mindset. That's the real goal of what we're doing. If you become a doctor, yes. That's a bonus for me. But that's not necessarily my goal. I'll say that. So I think you guys are doing the right things. The programs with KU Medicine, all this stuff. It really is a lot of exposure. So the reason I wrote these, wherever my children's books are, the reason I wrote them is because I wanted my kids to see themselves like that. I was trying to find a book that existed so my kids could see other Black kids, and I couldn't find one out there. So I wrote it, right? Since I wrote that, I've written 5. I teach people how to self-publish and stuff. One of my good buddies, who's associate producer on the documentary, he just published one too now, phenomenal children's book, right? So we're trying to get more and more of these books out there so, they can get out there more and more so kids can see themselves. So that exposure, that curiosity, that's the first thing there. And just keep on feeding that probably the way you guys are feeding it. But I do want to point out, we talk about this thing about we need more and more to be interested in medicine, which we do, that's true. At the same time, we already have a lot that are interested in medicine, right? So a lot of them do get to college. We do have Black pre-meds who are freshmen and sophomore in college. So, the elementary through high school, oftentimes, I would say teachers, you guys doing a great job getting them interested. They do the science class, they're interested. They get there, but they take organic chemistry. They might not do so well in it. They fail. And then they for whatever reason, they won't have that grit, or they'll get bad advising. Something happens to make them not continue along that journey. So there's 2 problems. One problem is, we need more of them interested from a young age. And as you mentioned, Dr. Yeager, that's just curriculum. You just have to find ways to have more curriculum, get them more exposure, Zoom things, books in the classroom, all those stuff. But the second level of it is, in high school, give them that mental rigor, teach them make sure you're prepared academically, first of all, but also give them that mental rigor, hey, you're gonna get to college. It's not going to be all roses, okay? If you struggle, you have to keep going. The kids, they need to learn that, because I'm so tired of seeing these kids do bad on, Chem 1, Chem 2, and then just drop it. Right? They need to understand it's going to be tough, but you've got to keep on going. You've got to keep on going. And I never thought about it, so I'm talking to you right now when you raise the question. Normally, I just say the pre-med advisors in college need to do a better job. But really, maybe it's the high school needs to do a better job preparing them, giving them that mental grit, that rigor, so that way they don't have to rely on the pre-med advisor, right? When they get to college, they know, okay, I did bad this time, it's okay. Next exam, I got it. Let me readjust, teach them all the stuff they need to keep on going once you're in college.
And thank you, because I truly agree. And we've been challenging our district to make sure that our curriculum is aligning and challenge them. We talk a lot about don't teach to the test, but teach them how to truly learn, grasp, fail and get back up. So that is so important. And I'm giving it back to Carol because she has some questions on her end.
Sorry, but before you jump in there, I would say though, so far, if I could say one thing, one desire would have, that would be the desire that our high schools can do a better job really preparing underrepresented minorities, not even academically, that's a given, but preparing them with that grit, like, hey, if you don't do well, this is what you need to do. Because I wasn't the only Black male when I started, there were a lot more people who looked like me who were pre-med that just didn't make it, right? And if they would have been prepared mentally to keep on pushing, then there'd be more of us. And there's data for it. So a lot of pre-meds, they take the MCAT, Black males specifically, they'll take the MCAT. If they don't do well, they don't apply to med school. Whereas other races, if they don't do well, they'll take it again and apply and apply and apply. But the application rate for Black men who don't do well in MCAT is lower than other groups. So that's the thing. They don't have the grit, they don't have that rigor to keep on trying to go,
I have Irene Cordillo. She's also a past board member, and she has a question for you, Dr. Dale.
Okay.
Irene?
Hi, Dr. Dale. Very nice to meet you. I definitely also enjoyed the documentary and a lot of lessons learned in equity and what we need to be doing resource-wise. So I appreciate your work. I also want to shout out real quick as a fellow Tiger, M-I-Z.
Z-O-U.
And so as a fellow Tiger, and I love where you've gone and where you're going and the work you're doing. But the heartbreak I had at the end was the young man. I can't remember his name now. What was his name?
At the end of your documentary.
The end of the documentary, the young man. I can't remember his name, but what he made me feel was what I feel like is happening. We used to call it peer pressure, right? In the old days, about what we're supposed to be like, and friends mattered more than anything. And what it reminded me of is social media and the intensity that social media has on our young people now about who they are, what they're supposed to be, what do you talk to? How do you talk to students and parents regarding the role of social media and how that plays into their future? Because it just seems that seems to be something that our kids are fixed on and consistently look at.
Yeah, good question. Thank you. The young man's name was Tripp.
Yes.
It's actually Melvin Randall III. We call him Tripp. So good question. Honestly, I probably don't talk to kids too much about social media specifically. What I talk to people about, and talk to everybody about this, is about a few things. Big one is knowing who you are, knowing what you want out of life, knowing your why in life. I often ask people to write down their mission statement, right? So I have a professional mission statement. I won't share my stuff, but my wife and I, we have a family mission statement. We have personal mission statements. So I tell people to do those things because social media is going to be there, is going to influence people, and there need to be guardrails. You have to know how to use it, things of that sort, and that's going to be on parents. But the most important part about social media, before social media, after social media is gone, the most important part is knowing who you are, know what you want in life. Because once you know that guides your decisions. That really guides your decisions. What I've learned is since I wrote down my mission statements, I make decisions a lot quicker. I make better decisions. And I'm so much more effective. I remember when I was a child, my mom was telling me something her boss told her. Her boss told her that people who are ultra successful in life tend to be people who know how to make quick decisions and make good decisions while they were young. And it's funny, she probably doesn't remember she told me that, but that stuck with me since I was like, I don't know, junior high or something like that. So I've always focused on how can I make quicker decisions and better decisions. And the answer for that with me came whenever I wrote down my mission statement, and whenever I figured out who I was. Because now, like, social media for me is, I don't even like social media. I do it because I have to do it for certain things, but honestly, I don't even really like social media. It's easy for me to do that because I know who I am. Because what happens is kids start trying to find your glorification in social media, self-glorification, things of that sort. They start trying to find, like you're talking about the peer pressure. They're looking for the pat on your back, all that stuff from social media, because they don't know who they are and they don't know where they want to go in life. I know where I want to go in life. Doesn't have to do with social media, right? So I don't need it. So if you can get a kid to say, okay, I teach this thing called grind. I made this thing called grind, and it's the success strategy we use to accomplish our goal. So G stands for goals, the R stands for reason, I stands for information, N stands for network, and D stands for discipline. And that's the structure I use to do things on. So I mean, if you can teach kids how to use the grind strategy to do things, it'll make your life so much more effective. And when they get to the reasons, that the R, that's the why. So when people can actually start to understand what's my why in life, why do I want to do this? Why do I want to be a doctor? Why do I want to be a librarian? Why do I want to be a teacher? That really helps you make decisions. And you can make better decisions that will not let you be influenced by peer pressure so much. That's the best answer I can give to that question, because you're always going to have social media influences. You're always going to have that stuff. The only real way you get out of around peer pressure, period, is by knowing who you are and what you want out of life. If you don't know what you want out of life, somebody's going to tell you what you want. It's probably not going to be the best thing for you. So I teach, like, literally right now. I have a session going on. It's called my pre-med Mondays. We teach pre-meds every Monday night. We coach pre-meds. So it's going on right now. My brother's running that session. If you go to that session, you ask any of those kids right now, they will tell you Dr. Dale's grind strategy. They'll tell you about knowing their why, knowing your mission statement. And those are the things that help people not worry so much about what other people think about them. And then for adults, for adults, what I focus on, I teach adults, you have to know the difference between your work and your job. A lot of adults will mix your work and your job, right? Your job is what you go to, you get paid for it, there's an exchange. It's a business transaction. Your work, you look at the Bible, God gave man work before he gave man woman. Work was the first thing God gave, right? Work is something that's very, very important. Work is inherent in who we are as people, right? Your work is, what's your life mission? What are you here to do? So regardless of what your job is, you're always going to have your work. And for adults, if you know what your work is, it makes it easier for you to make decisions. And making decisions, if you know that, it makes it, if you can make good decisions, that takes the peer pressure off, right? It takes the peer pressure off. It's hard for kids to understand that, but that's the framework that I approach it. Social media is always going to be there. It's always going to be a battle, though.
Thank you. And how's Trip doing at this point? How much?
Yeah, so he was at our Black Men. We had our Black Men and White Coats virtual. We did it virtually this year. He was there virtually, so he's doing well. And I'll tell you, we almost didn't want to put that in the documentary because I didn't expect that. I sent the director out there. I said, "Hey, Mikey, go film." I think I was getting up for work. I was like, let me just talk to Trip, and because Trip's mom is kind of they're like our biggest supporters. They're always sending us updates on Trips. I'm like, oh yeah, let's just talk to Trip, see how he's doing. I'm thinking he's gonna be like, oh yeah, I'm doing good. I'm getting straight A's. I had no idea that was coming. That was heavy. And what it reminded me of was, as adults, we're trying to process, because that's what George Floyd also. So we're trying to process these things in life. Like, man, how do we process? How do we make sense of this? But we forget that kids are hearing it. We forget that kids are trying to process it. And kids usually aren't going to be equipped to process it the way we are, right? So sometimes we forget how much of a weight it can be on a child's heart. And it never even occurred to me that, kids might be struggling with this in that capacity until I spoke to Trip. And then it made me think how many other kids are struggling with all this stuff like Trip is. And it's sad, but it just reminds me that we as adults, we need to take the time to talk to kids about these things and make sure they're okay. It's even my kids, right? With COVID, all this stuff. After talking to Trip, I was able to be more open with my kids. And I realized that even my older boy was kind of struggling with some of that stuff, So it's rough, but he's doing well. He's doing fine.
I'm glad you kept him in because he made an impact on many people, on documentary. Another question that somebody gave me was on a policy level, how can we put people of color to sit on medical boards? It is going to be tough though. And I think having more people of color on medical boards could also affect outreach and mentorship, I think.
Yeah, definitely. Thank you for the question. Two things there. Number one is they have to be excellent at your craft. Number one is we have to be excellent at our craft. We need to make sure our trainees are excellent at craft. So, I talk to med students like, how can I do this? How can I do that? What can I do? What can I do? What can I do? Like, before you start doing all that other stuff, make sure you're excellent at your craft, right? And I have to remind myself that, my dad's always telling me, people telling me, like, hey, Dale, you're out here making documentaries, you're doing this, you're doing that. Don't lose your skill set. Don't lose your craft skill set, because if you start losing your skill set, your level of respect will go down, right? If you're not excellent at your craft, people will look at you and say, well, he's not even a good lung doctor. Why should we look at him? He's doing all this other stuff. He can't take care of a patient, So you have to make sure that, especially as you're coming up, like, the med students and the residents and the fellows have to be excellent at your craft, right? Because that's where you really get that respect, first of all. The reason I could start doing all these things is because people knew I could take care of patients. Well, they saw me, they saw what I could do. So that gave me a way to start doing other things. So being excellent at your craft will open the doors for people to look and say, hey, you should be on the medical board. You should do this, right? So that's the first step. Number two, it goes back to what somebody mentioned before, sponsors. We need sponsors, right? So we need people out there, and this can be an organized thing, right? So you all, there's a lot of board member, high level member people here, right? So you all can actually make an intentional effort to find people who can be sponsors. People say, hey, we want you all to go out there and identify people who might be great for this role, right? So actually pre-identifying sponsors. The way sponsorship normally works right now is if I want a sponsor, I have to earn that, right? So you have to know I'm good at my craft, and then I have to go find you. Either you'll see me and call me out, or I have to go approach you. What if we already had a pre-made team of sponsors ready, whose job was to, okay, you need to go out there like recruiters. Your job is to go find, people that we think could be good for medical board, right? And just sponsors. So your job is to go out there, get to know you, and then after they deem you to be adequate or not adequate, after they deem you to be proficient, then they write a letter for you. They do whatever they have to do to get you to that next position. So I think that's critical. The other way we do it, which is really important, goes back to the idea of the Black tax and minority tax. Again, is we need to make sure that our underrepresented minorities aren't overburdened early in the journey, because if you're overburdened, again, you can't become excellent at your craft, right? If you're overburdened, you'll never get to a position where people see you and say, you know what, she should be on the board. He should be on the board, because you have to earn the role to be on the board. You have to be good enough. But if you're overburdened, how are you going to get to be good enough at something? I was just on a call an hour ago with East Tennessee State University. I was talking to some of the medical students. So medical student out there, she said, Dr. Dale, anytime the med school, I'm trying to study and such, but for all these diversity efforts, you're asking me to help in all these diversity efforts. And I'm like, yeah, that's going to be for you the rest of your life. That's going to happen to you, unfortunately. But it's unfair because all your other classmates are out there studying, and you're having to sit in these committee meetings and come up with plans to increase diversity, and you're being tasked to do administrative roles that you didn't sign up for. So how do you expect that young lady to excel when you're giving her jobs and probably not paying her for it or anything like that? You're giving her jobs while other kids just get to study and go to class. So we need to make way. We need to find ways to make sure our trainees and our young doctors and such are not overburdened, so they can move up. I'm in that situation right now. I emailed, in my institution, I'm one of the people who helps recruit some of the trainees and such. So I emailed the guy who runs the program today, my supervisor for the program. I said, hey, I need to talk to you. So I'm going to tell him, say, hey, look, I'm overburdened, right? And I need to make sure I have space so I can develop, so I can stay excellent in my craft, so I can do these things, because it's not fair that I'm doing all these million things while other people get to focus on your one thing and get excellent at it. And when it comes time to picking, like, I don't know how you guys are going to pick. I don't know how you're going to judge. So the three things I would say: number one is be excellent at your craft. Number two is, have a pre-identified sponsorship team to help identify people. And number three is help remove the burden from our people, our trainees, as you're moving up the ranks.
This question is from Jennifer. She didn't leave a last name. In the documentary, you talked about how Black males have one of the lowest life expectancies in the US, while talking about how important zip code is in determining health. How do you expect increasing the amount of Black male doctors, or male doctors, I would say, in medicine will contribute to closing the racial life expectancy gap? That's one. And is there an expectation they work with populations outside of the medical setting, for example, working on upstream factors with the community to prevent illnesses? Or do you expect to see a closing of the gap specifically through treatment of illnesses? That was a long one, but I had to put it all in.
No, yeah, thank you, Jennifer. Thank you for the question. So the first part of it, I'll answer with some data, those from the film. So, a study came out 2018, and the NBER study, and what they found was for Black male patients, if your physician is also Black, you're more likely to follow that physician's preventative healthcare recommendations. So that's a clear correlation to life expectancy increasing. So your doctor tells you, check your sugars, check your cholesterol, vaccines, all that stuff like that. Those things, we don't know this for facts, based from that study, but you would assume those things are going to increase life expectancy if Black men are getting screened for cancers, doing all those things like that. So that should be a clear correlation there. The second part about expectations, I don't think it's necessarily fair to expect them to have to go out in the community. Now, just my personal beliefs, like, should they? I think we should. I try to do it, but it's not a fair expectation. You shouldn't have to put that on somebody. They've gone through school and they've done this work. They're doing their best to take care of patients. Again, we shouldn't further tax them. They shouldn't be further taxed. I'll say that. Now, with that said, do I want them to? Yeah, I do. I want them to, but I'm not going to expect them to. Do I think we need to have it happen to create change? Yeah, I kind of do. But I'm never going to go chastise somebody and say, how come you're not out in the community doing community work? Because I know what they go through. I know they got kids. I know they got other stressors. I know what life is like. It's not easy, right? So making this documentary wasn't easy. Running these programs is not an easy thing. It's very stressful. It takes a lot of time. So it's not necessarily fair to say, hey, you're a Black man or a Black woman and you made it. So now it's your responsibility to have to do this. It's not fair for me to tell that to that person, but not go tell the same thing to the white person. Like healthcare, health disparities, that's a problem for everybody. Everybody should be vested in it. If I tell the Black man, Black woman, then I'm going to go tell everybody else to help out too.
Wonderful. Dr. Yeager, do you have any more?
Yes, I have two more. One, I work with women's health a lot. So that looks like, instead of ladies who may be interested in community health and wanted to be a doctor in their heyday, now they have children. So we offer maybe a doula or IBCLC, which is internationally board lactation consultants. We offer an alternative path. Is that something that you see that you may offer a physician's assistant or some pathway like that if students really do not have the funding to continue to take that test? Because in our comments, a lot of people mention, hey, it's a lot of money to retake the test. It's a lot of resources that they may not have. So is it an alternative path that you encourage for students?
No. And the reason I say no is because I will never tell a student not to pursue being a doctor because they can't find the money. Because I think you have to find a way to find that money. Now that's once you're at the level of like being a pre-med or something of that sort. If you've gone that far, if you've worked hard, if you're a pre-med, and you're in college and you want to be a doctor, like I say, don't quit. Don't quit. Like there's a way out there. There's resources, there's tools out there. Push hard and get it. I would never want to tell somebody not to chase their dream. Now, if they want to do that for a different reason, if they want to do that because that's what they want to do, then of course, my wife, she when we were pre-meds, she got, she did fine, she did okay as a pre-med, but when it was time to apply to med school, her advisor told her not to apply to med school, said go apply to be a PA. And my wife and I were talking about, we're like, yeah, maybe you should go be a PA, maybe. And then we're like, no, what are we talking about? No, you want to be a doctor, let's find a way to get you to be a doctor. Like, you know, we're not gonna back away from these things because we're scared, we can't find a way to get it done. You know, if it's what you want to do, then go after it. And, you know, she applied just one time. She got into 2 med schools. She ended up going to the #1 family medicine program in the country. So she did well, even after, you know, after we were doubting it. Now, on the other hand, if she was like, you know what, I really do like PA, you know, I am interested in that, I'll say, okay, let's go do that. But don't do it because you haven't yet figured out how to get the resources. The resources are out there. It's just about, you know, do you know where to go? Do you have the right sponsors? You know, nowadays you have in schools, NYU, a lot of schools are having free tuition, you know, things of that sort. There's a lot of rich people who pay for people's schools. Nobody knows this, right? But there's people out there who pay for people's schools that you would never know it, right? With all that said, though, I do understand it's hard. I do understand the realities of life. And I hate saying this, but at some point you do have to know when enough is enough. You know, at some point you do have to know, you do, like you said, hey, I've got a family now, I've got to do stuff. When you truly come to that point and you know it's real, you're not doing it out of fear, but you do it maybe out of responsibility because you have to do it. Then I would say, yes, you know, then I would say, okay, find something, but make sure you love it. Don't do it just because. Make sure it's something you want to do, something you love. But you know, that's a hard question because I struggle so much with telling people not to go after your dream because they can't find the resources. Because I believe there's always a way to find the resources if you push. Now, the thing that might can run up against everybody at some point in time is going to be time. You know, like I tell people, hey, you know, you might not want to be 90 years old and still applying to med school, right? You know, at some point, there might be that point for you to say, but hey, a guy emailed us the other day. He's 49, just got into med school. He's about to start med school at 49 years old. You know, so if it's what you want to do, you only live once. You live once. You know, so you know, have the life that you want to impact the world the way you want to impact the world. You only live once. You only get one shot at it.
I agree, and thank you for sharing that, because many times, sometimes we'll get pushed at as a school board that we're pushing the kids to college too much, that we're not pushing them to technical trade. And it's always a hard balance, like you mentioned, because when we talk about, okay, well, who's the manager of that trade? It's someone with a bachelor's degree. Who's the leader or who's over the director? They have some type of degree. So it's creating that balance. And like you said, knowing for yourself where that line is. And then my last question is, if you could have anything in the world, your vision, your big dream goal, what would that be? What would that be for us to see? Or what would you love to see when the end of the road comes for you? What would just make your heart full?
As it pertains to medicine
or whatever is truly in your heart, because you were on this path to share with others. You're traveling across the country, you know, and many times we don't see our impact until later on down the line. But what is it that you want us to take from this, or the world to take from Dr. Dale?
You know, I'm not here to preach, but like I said, I'm a person of faith, man. So, you know, I would want to see, you know, I just say thy kingdom come. I would just want to see a world that's beautiful and people are getting along. And, you know, I don't want to preach, I don't want to offend anybody, but I have a biblical background perspective. And so everything I do is kind of with that in mind. So it'll be thy kingdom come. You know, that's all. That's what I would say about that. I don't want anybody to remember anything about Dr. Dale. I couldn't care less. As a matter of fact, I tell my brother a lot, my wife, I said, I just want to fade to black. Like, I just want to go away where nobody even knows I exist and all this stuff is just running itself and nobody knows my name. That would be what I would want, really. So I don't need anybody to remember me or anything like that. I want people to get along. I want people to accomplish your goals. I want people to, you know, that's it. You know, that's it.
Dr. Dale, it was fantastic to have you with us. We appreciate your time. And thank you for extending also the documentary. What we'll do, we'll get all the emails, and then Kim, who's with the Kansas Public Libraries, will send you a list, and maybe then you can send them the password. so that they can redo it. Thank you again. And unless there's I know you've extended your time with us, but we really, really do appreciate it.
I do want to do one thing. So I do have another one starting in about 30 seconds, but I want to take a screenshot here. If everybody who doesn't mind putting your camera on, I'd love for you guys to get your cameras on. I want to take a quick screenshot and post it on social media. If you have Twitter, you guys post as well too. I'm just going to count out quick 1, 2, 3, and I'm going to take it. And it's hashtag BMWC, Black Men, White Coats movie. So hashtag BMWC movie. All right. 1, 2, 3. All right, I got mine. So if you guys don't mind posting, tweeting, all that, thank you guys so much. I'm going to run to my next one, which is starting right now.
Thank you so much. Keep in touch. Bye-bye.
Thanks.